So we will move on to the second presentation. Professor Chow already gave an introduction to the work of going to be presented by Professor Yuguo Li, and I will just very briefly introduce Professor Yuguo Li. He is the chair professor of building environment in mechanical engineer, and also honorary professor in School of Public Health. And from the title, you immediately can guess, and his work is very interdisciplinary. And he is he's the president of the Academy of Fellows of International Society for Indoor Air Quality. So I'm sure in the next 20-something minutes, you will learn a great deal about the quality of indoor air and how does that influence the virus transmission. Please welcome Professor Li.
Thank you, Professor Ren. And I just like to share my screen. Colleagues, my pleasure to discuss with you about the transmission routes of COVID-19 in indoor environment. Dean Professor Christoph Chow already described some of the things that make my life easier. I've been collaborating with colleagues in School of Public Health for years and has been very beneficial. I'd like to thank all the students and professors in public health, Huiling, Ben, and Malik, and my former students, and a number of CDCs in this effort. Of course, thank to RGC, HMIF, and SFC, and Hong Kong U for supporting us in the last 17 years. I think perhaps it's easier to look into the few characteristics related to transmission, which is, this is interesting. This transmission occurs at the age of AI and big data, and a lot of contact tracing. And China alone identified thousands of clusters and outbreaks, and in Hong Kong, perhaps less than 10. We don't have that many. We believe that respiratory, fecal, medical procedure-generated aerosols may all play a role, and pre-symptomatic, asymptomatic transmission adds to the complexity. So we have some positive samples on surfaces and a smaller perhaps positive air samples in hospitals. And we do know that there were a significant number of healthcare workers infected and many in other countries also. I like to make that comment. So I like to address two important and controversial questions. And one is faced by health authorities. This is that should the healthcare workers working with COVID-19 patients wear N95? And then also by heating, ventilation, air conditioning engineers, and can we ignore ventilation in homes, hospitals, and other buildings? So my message today is very clear, and healthcare workers should wear a N95. That's from, and then poor ventilation leads to transmission. And I start by looking at our current understanding of routes of respiratory transmission. This is, if it is less than 1.5, it's short range. If more, you have long range definition. You can call it close range and distant. And within close range, we would say that's possibly due to large droplets, and then I would call them short range airborne and also immediate surfaces. Currently, and in the long distance, you have formite. Currently, I believe health authorities believe large droplets and formite are the two dominant transmission routes for SARS-CoV-2. And unfortunately, and those statements actually at the moment, you do not have evidence to state that. So there is also no, there's no direct evidence, I would say, and there are some good studies coming up from our colleagues using animal tests and so on. And I believe also, unfortunately, if you collect evidence from outbreaks, and very often the immediate disinfection and sterilization are generally done after an outbreak identified. Hence that then you don't have evidence and we do not protect our crime scenes. You have no way to investigate. And I like to take a note there that in the close short range, there is a possibility for large droplets and short range airborne. These routes cannot be separated and distinguished even by engineers or by epidemiologists. And I see a paradox, ambiguity, inconsistency in the recommendation now. And no authorities admitted airborne transmission. WHO actually made a statement, COVID-19 is not airborne. But all national, international authorities recommended maintaining good ventilation. The question is, if not airborne, why ventilate? So you basically have the aerosol generation on one side, be it respiratory, fecal, or medical procedures. You have the other hand, exposure. I believe environmental factors in between play a role. The viruses might have jumped from animals or birds to human, but it is later on, I make statement, indoor environment, they can spread among us. So we spent time to look into 320 factor level cities in China who reported, or which reported daily the outbreaks and case number and description in the earlier part of epidemics. We identified 318 outbreaks, anything more than 2 or 3 or more cases. You find out the majority happen in homes, a little bit in transport. Why homes? We stay most of the time. And during COVID-19, city shut down, and that's where our last resort. It's interesting how important homes are. But if you have somebody came back from import cases, or in China that time came from Wuhan, there is a possibility for spread in homes, and that's simple. And this is interesting to look at dynamics. From that study, I listed every identified infection venues on this slide. And you look at this slide, apartment, of course, you have low-end shopping malls, low-end supermarket, barbershop, and taxi, shuttle bus. It's interesting. In Hong Kong, we also have Buddhist temple, bars, karaoke, and in Singapore, migrant dormitories. What they have in common? I do not see high-end offices, high-end shopping centers on the list. So here, I still choose some of the outbreaks to do a little study. And the first is not an outbreak. And early part of the, I helped Jiangsu CDC and to look into their monitoring in a hospital. They have only one hospital in Nanjing, very big one, the largest in the world. And they took hundreds of samples. You find out that those, this one doesn't work. Those, some positive samples mostly happen in related to toilets. So we feel that toilets, at least for mild symptoms, patients or toilet aerosols dominate. With the implication to infection is difficult to tell. However, in Guangdong, we had a report of this high-rise building apartment where a family lived at flat 1502, infected 2 families above, 25th floor and 27th floor. And we made measurement during the, during the city shutdown, and then it's quarantine. The entire building was empty. So we had the opportunity to do some measurement there. And in short, we actually, with the data, we find out it was the drainage system. And unfortunately, whether I can minimize this part. And so it was a drainage system that caused the spread of aerosols going from one floor to another and led to this infection. And there was a very, very serious tracer gas measurement. And this outbreak, they also have a video in the lift, so you know whether there was no really lift transmission. And Professor K.Y. Yun and Professor Chow all mentioned about our Homing House outbreak, Hong Tai House outbreak. I consider this Guangdong outbreak the two outbreaks, new COVID-19 outbreak in Hong Kong and Amoy Garden SARS-1 outbreak in 2003, in particular for Block E and Flat 7. And they are probably from the same reason. I feel I don't have time to describe in detail. I believe the stack effect in the drainage pipe play a role. And they have one thing in common, very low. The infection occurs from the lower to upper, and all infections do not happen at the lower level of the stack, of the building. So this is very interesting. Need further study, and I look forward to it to collaborate with people, our colleagues in public health. Talking about airborne transmission, I like to talk about non-airborne transmission first. And Diamond Princess was really a big story, and a lot of suspicions, speculation that central air conditioning might play a role for between stateroom infection. But if you do a proper study, we look at the data released by Japanese government, incomplete data. They only release about 200 out of 300, more than 300 patients with symptoms, cases data. And you find out for those infected who stayed in the room without infected case, and this means it's a new infection, majority of them, actually all of those infection occurs between the 5th of February and the 5th February, 7 a.m. in quarantine started. So with a little bit more study of central air conditioning system by looking at the literature, how Mitsubishi designed the ship, we concluded central air conditioning for the stateroom did not lead to infection. And we all know in Hong Kong, the World Dream ship, and actually the World Dream ship had a little outbreak, and which was studied by Guangdong CDC. We look at data, we find out 21 cases, 8 families, they are randomly distributed in this big, huge ship, 350 meters long, maybe 88 air handling units. Each floor would have 4 or 5. You would expect some kind of spatial, cluster that did not exist. So I conclude these things did not exist. Now I like to look into a few outbreaks. And the first one is a restaurant outbreak in Guangzhou. And in this outbreak, a family A stayed in this restaurant, and this is where the table were. And there were 2 smaller tables and sat with 2 local families. And at that time, Guangzhou did not have many cases. It's very unlikely happen outside in the community. And they find that these 2 families are low-key. They were very calm and quiet, while this family was active with a child. And then this was suspected index patient, and then infected 3 on table 2 and 2 on table C. And different from the SARS-1 outbreaks, this time in China, they had videos happen. Lucky that this restaurant had videos both in the lift and in the restaurant. So we're able to find out there is no role for close contact and no role in the lift lobby. And the overlap time between this family and the other families is clearly known. For this family, and this was potentially 3 families, A, B, and C, and this A actually had a distance more than 4.6 meters to this infected patient, which is C1. So we were taking measurement. Again, we found the restaurant owner, and luckily he allowed us to do the measurement. We measured ventilation, we measured the tracer. So let one person have a little gas here, and you mimic the axial droplets, and you measure where do they go in the room. And so we like to mention that in this particular one, there are 5 air conditioners. And these air conditioners, and this one create this little bubble here, and the virus circulate, but eventually they migrate to other part of the restaurant, as you can see from the computational fluid dynamic simulation on the right. Most importantly, in this restaurant, the ventilation rate was measured only to be 1 liter per second per person. In offices where you are sitting now, they are designed by 10 liter per second. Our estate office has done a good job in most of the classrooms, offices in Hong Kong U. This is in high-end offices, high-end hotels, probably even in Diamond Princess. But in this restaurant, only 1 liter per second per person, which is very, very serious. So we think the outbreak is contributed, is due to insufficient ventilation in this building, in this outbreak. In Hong Kong, we all know, many of us perhaps know this Hunan bus outbreak. And Professor Malik Paris, in one of the discussions earlier, he reminded me how important, interesting this was. So I spent time, and then we were able to find the original involved 2 buses and the 2 original drivers. And we were able to do the measurement. And this is because there's interesting also, this patient, the original patient is a young man, 22 years old, and decided to travel from the capital city, Changsha, to a small town, and we were able to study that on the original route. So we know how fast they drive. And then this is a very interesting study. We still have not finished the paper yet. He infected totally 10, but actually among this infected, there was this person in different color. This person did not take the same bus. On the bus back from the small city back to Changsha, and he said here he got also infected. So there is a possible role of formite or something. And in this bus, the ventilation was measured to be only 2 liter per second per person. You know, for bus, the faster you drive, the greater the ventilation. But very often the old bus, they don't have this. So, and you can simulate as on the bus, as in the restaurant, you can see how that's an interesting one I must mention. For this bus, originally we did not detect, actually on the driver, this driver is here at the lower, on the driver's side, the attack rates are higher than the other side. And this due to the particular, because it's very cold outside, only some 9-8 degrees, and there is a heater on the driver's side, but the heater on the other side failed. So you can find out flow patterns and introduce this so that on this side, there are less perhaps dispersion, but this side you have more viruses. And we are still continuing to refine study. For this small bus, he infected 2, and this is very, I mean, the students, Professor Han Jian from Sun Yat-sen University did a very, very serious measurement. And so the big bus ventilation rate is 2 liter per second, time integrated for the minibus only 3.3. It's very interesting. I mean, I mentioned before, the requirement is 10. So how far we can go, at least for 3 seems to be not good. So the ventilation rate lower than 3 not good. We probably find other outbreaks, we find more. Anyway, I like to come back to this paradox. I believe that if we resolve this paradox, we can live to save life. And you can see in Italy, many, I mean, I don't know how many people, healthcare worker died, but according to this, already 77. So I think this is just for discussion. I believe this paradox about airborne transmission might be originated from our collective fear. And this is actually the same for influenza. I suggest there are 2 kinds of airborne transmission. One is can occur at normal indoor conditions. This is fearful, like tuberculosis. But on the other, probably only occur in crowded and poorly ventilated areas. And if you do a better ventilation staying away from such location, that will be fine. That's not fearful. There are many things in the transmission route confusions. For instance, the large droplets. If you go to internet, WHO, CHP, and you will find that the threshold size is 5 to 10 microns. This is wrong, actually. If you fire a outbreak of droplets coming to you, and you can easily, using engineering principle, you find out the threshold size is 50 to 100. smaller that you can inhale. There is no way that those, the small ones, you cannot deposit. Forget about that. There's no deposition on your face, on your nose, on your eye, on mouth. And this one has been very, very hard to change the dominant theory. And the so-called 5 to 10 micron is wrong. And we wrote quite a few papers about that. By accident, before this COVID-19, so we submitted a paper just last November, we also mechanistically, the short-range airborne routes I defined earlier can be 10 times more important than the large droplets. So to me now, I believe that perhaps not droplets transmission, perhaps that droplet transmission play a role, not much if you study very carefully. You find out the short-range airborne is more important. If this is true, then I can make some further discussion. This is how short-range airborne works. Let's say that you exhale carbon dioxide at 50,000 ppm. They all know, but actually, as long, when you at normal situations, actually to a distance of 1 meter or 2 meters, then you go down to 2,500. In the room, we normally maintain 1,000 ppm. So by the time they go further, your expired jet, the velocity there goes close to what happened in the room, which is about 0.2 meters per second. And then you don't see the jet anymore. So, and we know very well how 10 liters per second per person works. And we need to dilute our exhaled breath by 100 times to make sure in the room it is okay. And so if we saw, this is my new assumption, a new hypothesis. I believe the poor ventilation leads to something called, we might call it extended short-range airborne phenomenon. So, and what it means that if the room ventilation is very, very bad, actually in the room, you will have a concentration about, instead of 1,000, probably 4,000 ppm in the room. By doing that, actually originally, normally a non-long-range airborne transmission becomes long-range airborne. And very often, after 1 hour or 50 minutes, this whole thing becomes serious. So because of time, I will be very quick with the sum. This is a very important diagram I draw during this outbreak, so that I feel that basically, if this is a person between 2 people, and of course at 0 distance, you have the highest concentration of viruses. And we talk about this perhaps threshold distance 1.5 meter. And within this is called short-range airborne. And now, then they go to a normal room situation. If normal ventilation, they do not exist, then this is we can assume World Dream, Diamond Princess, high-end offices, high-end shopping centers, your offices right now, and then they don't have the transmission of COVID-19 or influenza even. But now, if the ventilation is poorer than this, as I've shown in 2 cases, the restaurant and the food buses, and then you have poor ventilation, then your concentration is somewhere in the expired jet. Of course, actually, there is a threshold ventilation. When the ventilation of this room is the same as your exhale air amount, then basically that's the worst. And go up, then you cannot live. This situation, poor ventilation is bad. But if the ventilation is improved, then very good. If you go to outdoor conditions, it doesn't exist. So expired air jet is very, very important. Actually, what you and I do, social distancing, is about avoid it. So avoid expired jet politely. But now we all have a mask, so you don't have. Now I don't have a mask. And face mask can block the expired jet. I feel that's the main reason. If you smell others exhale odor, it's time to stay away. I wonder how about my time goes. If you go to current recommendation, you do not find from China National Health Commission, US CDC, World Health Organization, you don't find this. So this is worry. And there are right now, a large number of scientists in the world, probably hundreds, and we are writing letters to different organizations. We ask the community to consider. I think Professor Ben Collin mentioned a lot about the intervention. I like to make a comments quick and without going to details. I think that a lot of intervention strategies are paired and they work together. Ventilation, crowding are paired, mask wearing, hand hygiene are paired, hand hygiene, surface hygiene are paired. You cannot do one. And I also like to mention that to get the exposure and infected at one specific time and location is a very low probability event. And I just want to say that people do not need to blame others in case you meet someone infected, and which is, I think, lastly, I like to present a need for post-COVID-19. I think we all, the association, you look at literature between crowding infection are known since early 19th centuries. And England developed one of the first housing policy, and it was based on the policy then. It appears that we still ignore some of this effect. We ignore that the buildings and transport capital in the world are connected by our movement and also the virus. And in now and then, different parts of societies, including World Health Organization, thinks we have a right to breathe healthy indoor air. But as I mentioned, if this hypothesis that most outbreaks occurs in crowded, in poorly ventilated spaces, at least some of them, then in the post-pandemic future, mankind need reflect deeply the need for healthy building. And this is where architecture, engineering, public health, and even health, social sciences, we can work together. Thank you very much.
This is the question from Alfonso.
All right. So thanks to Professor Lee. The work you have presented have tremendous impact on the design of the city and the design of buildings and design of living and working space. And this pandemic definitely is a wake-up call for us to invest in those areas. And you have mentioned that you're going to, and your work engage many disciplines. And I have one question from our audience is, do you have any thought about engaging private sectors, the property developers and the builders and building management, and how to engage them to be aware of and to be aware of the role they can play and how important their role is in control the disease? And do you have any thought to engage them?
Yeah, I think in Hong Kong and elsewhere, there have been a significant community effort. And in Hong Kong, Green Building Council and the government all have all kind of facilities and platforms where you engage, including private sectors. And this actually, the idea needs input from architects, urban planning, everybody. So a lot of work to do. Actually, even before this pandemic, we have been contacted by one, at least my head of the department would know, at least one private developer in Hong Kong. Actually, they already had the idea to develop healthy buildings in Hong Kong. And perhaps this pandemic would lead to a greater effort among us all.
I have a more technical question from Alfonso, and that is, how do you validate your CFD simulation, and what's the confidence level?
This time is different. CFD stands for computational fluid dynamics, and this is one of the measurement method where you reproduce what happened at the time of infection. And for both the restaurant and the bars, we have done tremendous, very detailed measurement. And because the original bus, everything original, we do both ventilation rate and dispersion studies and agreement. In the paper, we have shown that for the restaurant, agreement is very good. Of course, we can never be able to go back to the original setting. And even with a video, we cannot pinpoint exact location of the seats. And also in our CFD, we assume everybody are the same. Actually, we use, as you can see, a female body to represent everybody, including the children, parents, and the aged. And validation is always challenging. And there are, I mean, you all know that fluid dynamics is one of the fundamental equations that human being can only use computer to solve.
I have another question is, you mentioned the study result in many different environments, including house, boat, restaurant. And is there a solid study about the air quality in airplane? I think many people are very concerned about getting into airplane for many, many hours.
This is a very good question. And this is why we actually put the buses as a key study, key outbreak to study. This is important for transport. And the airplanes is an environment where the ventilation rate is low. And they provide for economy, they only provide you give 4 liters per second per person. And the economy, business, you higher. I hope the university will allow us to take business travel and simple at this time. Actually, business level, you get more airflow, ventilation. But there is a difference in airplanes and cruise ship. In airplane, they use HEPA filters, high performance filters. And that probably can help. On the other hand, in airplanes, it's natural that people stay close. You know this, and this is because the dominance of short-range transmission and for the close contact, I don't know how to handle. There are, I have been contacted by manufacturers in both China and the US, and it's just there's no time to do the airplane right now, and because there are no outbreaks reported on airplanes so far. Identified.
Okay, I will ask for the audience one last question, which can be very useful for many people, is how to recognize when you walk into a building, walk into a room, how to recognize this room is well ventilated or not well ventilated, and then they can be aware of that. So that's useful for a lot of people. Can you answer that question?
Yeah, sure. I think that very simple. Everyone have this instinct to do it. If you feel the buildings is crowded and you smell other people's body odor, go away politely. If you want to go to more scientific, I think 1,000 Hong Kong dollars, or maybe a few thousand Hong Kong dollars will buy you a carbon dioxide sensor. Actually, this little monitor, if you find anything more than 1,500 ppm, this is just number came. I mean, a lot of people debate which number, but for convenience, if it is more than 1,000 ppm, I would worry. But if more than 2,000, and go out of the space.
Thank you very much. That's a very useful comment, and it's very practically useful. And thank you for the exciting and informative presentation on air quality. Thank you.
Thank you.